Welcome to YARKUD International. Let's see today recent Prometric exam questionation for the Saudi nurses. Okay. So, first question. There is a crisis in the hospital. Which of the following category of patient should be evacuated first during a fire crisis? If there is a fire in the hospital, as a nurse, you are inside. So, which patient you will evacuate first? Which patient you will send out first? That is the question. Okay, you have to be remember. I will be telling the clues and key points, and you have to write it down so that it will be very easy to pass your promotric examination. Okay, so here you have to remember first thing you have to do ambulatory patient. Okay, because without help they can go because they can able to walk, right? So you have to tell the ambulatory patient, go out, go out. Okay, so second thing, only wheelchair patient. Mostly wheelchair patient having the relative. So with the relative or you are helping, you have to shift the patient. Second is wheelchair patient, you have to evacuate. Third point, third category is bedridden patient, sick patient with the mattress. Because that patients, you need the help because only 2 members, 3 members only holding and shifting the patient. So that will be third option, third category only. So first you will be evacuate. Which patient? Answer is ambulatory patient. Got the point? So if they ask you second, it will be the wheelchair patient. Third only there is a bedridden critical patient. Okay, got the point? So we'll move on to the next question. A nurse develops a plan of care for the child at risk of tonic-clonic seizure. The nurse identified seizure precaution and documents that which item needed to be placed at the child bedside. Okay. So here you know the Saudi Promotic exam, all the nursing examination nowadays, all the 4 options are correct only. Okay. So if you see option A, emergency car. B, tracheostomy set. C, padded tongue plate. D, suction equipment and oxygen. These 4 will be needed for seizure patient. Okay, seizure child. So these will be like that only, but you have to select the best. Okay, best answer will be the answer. Only one best answer will be that. So you have to be read the question carefully, then only you can able to answer it. Here they are asked the child at risk of tonic-clonic seizure. Okay, now no seizure is happening. Currently, there is seizure. You need the tracheostomy said, you need the emergency card, you need the padded tongue plate, right? But now currently, there is only the nurse is planning of care. Got the point? So, seizure precaution, planning of care, what you have to keep in the bedside? It is suctioning equipment and the oxygen. Okay, it is the basic one. You have to keep it in the patient bedside. That's all. Okay, it's very simple. So don't think too much and write it the emergency cardiac tracheostomy. All needed. But here, what is the question asked? There is only planning of care. Okay, so basically suctioning and suctioning equipment and oxygen with the oxygen bed only we will be giving for the child. Okay, that will be the option. Let's see the next question. A nurse is assessing a client with a chronic airflow limitation and noted that the client has a barrel chest. The nurse interprets that this client has which of the following form of chronic airflow limitation. What is chronic airflow limitation? That is nothing but COPD. Okay, chronic obstructive disorder only. Okay, so if you see the chronic patient with the COPD, there will be the 2 conditions. Under the COPD, we have 2 conditions. Okay, chronic bronchitis and emphysema. So now you have to just find out whether it is chronic bronchitis or whether it is emphysema. That's all. So here the key point, they have given barrel chest. Barrel chest seen in which patient? Patient with the emphysema, there is alveoli damage. Okay, you have to know the disease condition. So emphysema patient have the alveoli, there is damage. So there is the air will be not going out. It is trapped inside your lung. So the lungs will be filled with air. That is only making the barrel chest. Got the point? So here the condition called emphysema. So answer is emphysema. Okay, got the point? So likewise, so you have to be choose the answer. To confuse you, there is so much bronchitis, bronchial asthma, bronchial asthma with bronchitis. Okay, so you have to be remember barrel chest. It will be seen in emphysema patient. Okay, let's see the next question. Here, the following laboratory data are presented in the client chart. Which one should the nurse report immediately? Okay, so for that, you have to know the normal values, right? Okay, here, serum sodium level. What is the normal? 135 to 145 milliequal per liter. So here 134 only. Okay, it's okay, right? So option B is serum potassium level. What is the normal? 3.5 to 5 will be milliequal per liter will be normal. Okay, here also 3.4, it is okay. What is the platelet level? It will be a 30,000 to per cubic millimeter they have given. What is the normal one? If it is 1,50,000 to 4,50,000, that is a normal platelet level. Here only 30,000 is given. So high risk for bleeding, right? So this should be reported because HCO3 also, bicarb also, there is 22 given. What is the normal? 22 to 28 is normal. So the patient is normal only. So the platelet, there is high risk of bleeding because only 30,000 is there. So immediately should be report for the platelet 30,000. Got the point? So this one, you have to know the normal values, then only you can able to answer it. Okay. Let's see the next one. Which of the following is the primary reason to teach pursely breathing to client with the emphysema? Okay, so here they are given again the emphysema question. So here teaching given already pursely. Okay, so one of the emphysema patient main teaching we will give pursely breathing. So here they are asking what is the reason to give pursely breathing? Okay, so we have seen already. We'll say read the option, then we'll go back to the condition. To promote option A, to promote oxygen intake. B is to strengthen the diaphragm. C is to strengthen the intercostal muscle. D to promote carbon dioxide elimination. Okay, let's see the condition here. I have told you already under the COPD, there is emphysema and chronic bronchitis. Two condition together we will call there is a chronic obstructive pulmonary disease, COPD. Okay. So here the emphysema patient, I have told you already, there is a alveoli damage. So all the air exchange will be done in alveoli. So all the air will be just trapped into the lungs. It is not going out. That is the problem. Because of that only viral chest is coming. So there is a high chance of collapsed airway. So to reduce this, we will just tell the patient pursely breathing. See, normally they are breathing only small amount of the air is coming out. But if you see pursely breathing, there is a prolonged expiration. Lips are creating the pressure. So there is so much of the air inside. Which air? It is CO. There is a CO2, right? The CO2 will be eliminated. Okay, that will be the answer. To promote the carbon dioxide elimination, we will just giving the patient to do the pursely breathing. Okay, so emphysema patient, why we are giving pursely breathing teaching? To promote carbon dioxide elimination. Got the point? So this is the answer. So these are the questions from the Prometric examination. Here the YARKUD International, we are giving the online training for Prometric, SNB, MOH, DHA, HAD, OET, IELTS, and Omen Pearson View nursing examination. All the nursing coaching will be available here.